Hi, everybody. I want to thank you all, first of all, for being here today and shining a really important light on this issue that is causing so much anxiety amongst parents in our community. My name is Lana Hansen. I am a parent of, actually a very proud parent of two brilliant and beautiful children that are under the age of 12 and attend AISD. And what I'm looking at as a parent today is very different than what I saw last year at this time. Last year, our community leaders were able to implement safety precautions that allowed us to mitigate the spread of the virus in our public schools. And today, I'm being asked to send my children into the public school district where we are not able to implement those safety precautions that are so necessary to protect our children. And that's due to an executive order by our governor. In addition, we're looking at a virus that's a very different beast, right? We're watching it put children in pediatric ICUs in our city, across our state, and across our nation. And I can't, for the life of me, understand why we would not why our governor would not allow our local elected politicians, the people we put in place to protect us, to do what is best for our community that's in stage 5. We know that what is best for Austin is not necessarily best for Fredericksburg or Lubbock or McAllen or Dallas. And so we have a team of people that we trust as constituents to do what is best for our community, but their hands are being tied. And so I am here today to ask those people that I trust, our AISD trustees, to please call for a vote. I'm begging. Please call for a vote to have enhanced safety precautions in our schools that include a mask mandate. All of us want our children back in school. We want them learning inside their peers and building relationships with their educators. We want them back. But in order to do that, we have to implement the safety precautions that are going to mitigate the spread of this virus. Thank you. And now Lucy's going to speak.
Hi there, my name is Lucy. Oh, there goes my mask. And I am a student in AISD. Now, a mask mandate is extremely important to me for a lot of reasons, but I'd like to start with a quick story. This February, before I was able to be vaccinated, I got COVID-19, and I have asthma. So I was eligible to get the monoclonal antibody treatment. And when I tell you that even though that may have been the difference between life and death for me, it was the scariest thing I've ever gone through. I got to spend 8 hours in a field hospital hooked up to a bunch of tubes and machines, and I am so grateful that I got to do that, but I went into that alone without my parents. I was not vaccinated, and I was terrified. And more than anything, I don't want any other students to have to go through that. I have a little brother who also has asthma, and you know, he's under 12 and he can't be vaccinated. And when I think about the things that I am the most terrified of, it is having to see my brother in the same pain that I was in, having to see him in a hospital, having to see him go through the struggle not only of having COVID, but of having that, living with that fear. When I go to school every day, you know, I'm terrified that I'm gonna have to bring something home to him that he's gonna have to live with for the rest of his life. We know that COVID brings upon things that stick with you for the rest of your life. I used to not have to carry my inhaler with me, and now I have to take it with me everywhere for fear that I'll have an asthma attack. I'm so scared. I am scared every single day, and it is beyond important to me that we are required to wear masks in school, because I don't want to be scared to go to school. I don't want to be scared to learn. I want to go to school and I want to learn, and I want to do that without fear of getting my family sick, without fear of my friends getting their families sick. One of my very best friends in the world has a brother who, if exposed to COVID, he will die. And watching her have to live with that fear is just the worst thing in the world. So all I ask is that AISD just consider not only what it's like for parents, but what it's like for students who have to watch this every day. I'm lucky enough to be vaccinated, but so many of my peers are not. And, you know, I struggle to think of the kind of fear that they live with. So all I ask is that you consider us. We're students. All we want to do is learn, and we want to do it in a place that we feel safe. Thank you so much. And now I would like to call Jyoti. Thank you.
Good morning. This is my first time, so please excuse me. I'm Jyoti. My full name is Jyoti Kapoor. I am a pediatrician in the community, and I'm also the mother of 2 children under the age of 12 who are in AISD schools. I'll begin with an experience of my own medical career. I was a resident, a senior resident, and I was managing the inpatient pediatrics unit in a very busy hospital in Houston. A 5-year-old girl with asthma was admitted that night. She was on the verge of respiratory failure. Her breathing was so hard that literally her eyes were popping out. She needed to be in the ICU. The standard of care called for her to be in the ICU on continuous nebulization treatments and high flow oxygen. But like most winters, all the PICUs, the pediatric ICUs in the area were on divert. We had to manage her on the floor. So what we did is we parked our computers outside her room, kept her room open, and we ran the entire service from there. I was very scared. I was scared that we were not going to be able to save that child's life. I don't ever want to be there again. We are getting there though. The hospitals, PICUs, ERs, all are at capacity. We are in the middle of a very severe RSV season. And then we are seeing increased admissions every day from COVID-19. The Delta variant is not like the previous variants of COVID, and we know that. We are losing children, and we feel as a community of pediatricians that losing even one child to this preventable cause is one too many. You can help us not get there. Masks are the single most effective way of preventing transmission in the unvaccinated. The elementary school age children are not eligible for masks, but they are, for vaccinations, but they can wear masks. Indeed, they are very resilient. They don't have any psychosocial or emotional problems with wearing masks, as we learned last year. When all children and the teachers collectively wear masks, it brings out a feeling of community welfare and a connection to something bigger in them. They learn many valuable life lessons. This is an opportunity for them to learn valuable life lessons like resilience, empathy, connection, unity, and most importantly, through this, they will learn that together we can overcome any challenge and hardship. With this goal of perseverance, preserving the life of our beautiful and vulnerable children, many physicians in the Austin area have started a petition, and we have signed. As of today, 48 hours, the petition was started 48 hours ago, we have close to 700 signatures. This petition, thank you. This petition is advocating for mask mandate in all school districts. We are imploring our Board of Trustees to please support us in doing the same. Your support could markedly change the trajectory of our children's future and set foot forward as the nation's trailblazers in putting our children's futures above all other agendas. Please know that we, as a community of physicians, are fully supportive of your decision of mask mandate and safety precautions in school, and will walk hand in hand all along the way as we ride out this wave. We can do it, we just need your support. Thank you.
And next we have Mary.
Hello, my name is Mary. My story is not unique in the fact that I'm a single mother of 2 children who are little, both elementary aged. I'm also a working parent. The one thing that does make us a little bit unique is that my family carries a genetic blood disorder that can make COVID-19 extra dangerous. My kid has it, I have it, my mom has it, my sisters have it. So last year, when everybody first started into this, we pretty much were in a situation where we had to stay home at all costs because one mistake in our bubble could kill our whole family. Now, thankfully, because of the vaccine, things have changed a little bit. I'm able to go back to work. I wasn't able to work for the past year, which you can imagine was really, really difficult. But now, I've been looking forward to sending the kids back to school and keeping my job. If the mask mandate doesn't happen, that might not happen either. And I, along with many, many other people for lots of different reasons, maybe it's a medical situation like ours. Perhaps you're an essential worker and you don't have the option to stay home and homeschool your kids or virtual teach them. And all of us are going to be out of work because we're going to have to be forced to choose between our child's safety and our family's security. And that's not something that should be happening in this city. Thanks. Next, we have Anna.
Good morning, everybody. My name is Anna. I'm a pediatric nurse here in the Central Texas area. I'm also a concerned parent that has children in the public school system here in Texas. And I completely support AISD implementing a mask mandate to protect students, teachers, and staff. Studies show that masks are effective in preventing the spread of not only COVID-19, but flu, RSV, and a multitude of other viral illnesses. Our pediatric hospitals are experiencing an unusual summer respiratory season and are seeing many patients very ill with RSV. This is usually an illness we see in the winter. Over the last few weeks, we've also seen an uptick in pediatric COVID hospitalizations. More of those children are coming in symptomatic and sicker than we saw at the beginning and through this pandemic. This is concerning as we prepare to open schools and we have a divided community on mask wearing. Also with a variant of the COVID virus that is more infectious and more easily spread. A mask mandate could prevent our pediatric hospitals from becoming overwhelmed from many viral illnesses, not just COVID-19. It's wonderful that many school districts like AISD have virtual learning options, but the reality is, as many have spoken here today, that many family situations do not allow for parents to stay home with their children to teach them or help them learn virtually. Students in grades K through 6 are younger. They can't stay home by themselves, and they are a more vulnerable population, the most vulnerable population, because they cannot be vaccinated. Every student deserves a safe place to learn. A mask mandate in schools provides a safer learning environment for all children regardless of their personal home situations. Not only are masks effective at preventing the spread of infection, but we also know that masks are more effective when all parties exposed to each other wear them, meaning I protect you when I wear my mask, you protect me when you wear your mask. A mask mandate would not only protect our schools, but it would also protect our community. It would be less likely for a child to get infected and spread it to other family members in the home. Not only are we seeing increased pediatric COVID hospitalizations, but our local healthcare systems treating adult patients are overwhelmed right now as well. Nurses and other healthcare workers are leaving the bedside from exhaustion and burnout. Many of them have been working extra shifts off and on since the beginning of this pandemic, and it's just not sustainable. Just a few days ago, public health officials and representatives from several of the Austin area hospitals have sounded the alarm that this is a critical time for our healthcare systems. When weather experts send out flash flood warnings, local entities closed flooded streets to protect lives, and no one balks at that. We expect it. Our medical experts are sounding alarms right now, and as a parent, I expect my school district to implement safety measures to protect my children. A majority of experts agree, including myself, that getting vaccinated is so important right now. So I would encourage everyone to do that. But even if everyone went out and got vaccinated today, it would be weeks, maybe even a few months before our healthcare system could recover. A mask mandate is something we can do right now to add an extra layer of protection while we get our community more time to get vaccinated. Last year, when Austin experienced its summer surge, personal responsibility did not resolve the surge. A state mask mandate did, and once everyone did their part, we saw a reduction in infections and in hospitalizations. I completely support AISD and any other school district who enforce or implement a mask mandate this school year.
And next we have Carmela.
Good afternoon. My name is Carmela, and I am an early childhood teacher. I'm also a daughter of an 80-year-old mother. I'm a sister, and I'm a tia of 2 boys, brilliant boys under 5. And I learned a lot over this pandemic. I've learned a lot on how to be a better sister, how to be a better tia, and how to be a better daughter. I've also learned how to be a better teacher. A family member, as a daughter, as a sister, as a tia, I learned that we need to take care of each other, that my family is most important to me, that we are only as strong as our most vulnerable member. And that for a while was my mother with health issues. And now I feel that it's my nephews who are both under 5. So I ask that you would help care for them and lift them up. And make them feel safe. As a teacher, I also learned that keeping my students safe in school is important. We wore masks last year, and we were successful to keep people, students and teachers healthy and safe. And you know, in school, every month we have drills. Sometimes it's a fire drill. Sometimes it's a risky weather drill, and sometimes it's a drill about someone dangerous coming into our school. And I just want to say to AISD, to the trustees, that this is not a drill, that our students are in danger. There's a variant out there that is harmful, so let's keep them safe. Please, please implement a mask mandate to keep our students safe. Because what kind of community are we if we do not keep our most vulnerable population safe? I also know that their ICU beds are in short supply, and that this disease is impacting communities like mine, Black and brown communities. So also, please lift up. Please protect our most vulnerable population, and please let us all wear masks. Thank you. Next is Mike Siegel.
Howdy y'all. My name is Mike Siegel. I'm a parent of 2 AISD students, both my children who are under 12 and cannot be vaccinated. I'm also one of the founders, along with many people here, of Safe Schools for All. And also, I'm a former city attorney for the city of Austin who had the honor of suing Greg Abbott multiple times on behalf of the people of Austin. And I will say that as a coalition, we are considering our options, including going to court. But our first priority is to encourage the Austin School Board to do the right thing, which is also a very difficult thing, and we acknowledge that. But we need them to take a strong stand, pass a mask policy, and implement necessary safety measures. And if and when the school board takes this action on our behalf, we will be there to support them, whether that means politically, legally, financially, because we do know there are a lot of threats out there, that there's a governor, an attorney general, and others who are talking about fines and withholding money and imposing sanctions against our superintendent in our district. And so we want our school board to take strong action for us in the face of these threats, and we want the trustees to know that we will support them if and when any of these consequences come, because this is a matter of life and death for our children, for our school workers, and for the broader community. And it's also a matter of our rights under the law. And so we've been exploring legal action because the governor has certainly exceeded his authority under the Disaster Act. And by threatening the lives of our children, he's violating many constitutional rights. And this emergency order of Governor Abbott would punish our school district if we have a mask mandate. But that order was made at a completely different time of the pandemic, when cases were in decline, and we didn't know what we know now about the Delta variant. So we're now at stage 5, and we know the Delta variant is a serious risk for our children, and our kids under 12 don't even have the option of being vaccinated. So in this context, Abbott is not using the Disaster Act to protect Texans or prevent harm. He's actually inflicting harm, and he's violating our rights. So we know some of this is going to have to play out in the courts, but this is a matter that's bigger than any single lawsuit or judge. Cities across Texas, even across the South, are being stopped from common sense safety precautions like masks that will save lives. And at what point does this become an issue that we need the federal government to take action on? In the 1950s and 1960s, the federal government did intervene in the South in places like Texas and other states to protect voting rights and to protect access to a free public education for all. And here we are again, our basic rights are under attack. The right of our children to attend school in a safe environment. And so we'd ask the federal government, our members of Congress, the White House, the Department of Justice, the Department of Education, please follow this closely. Because if our school board does the right thing and requires masks, the state of Texas is going to try to punish us. And that will be a good time for the White House and the federal government to get involved. Because the right to a free public education is fundamental to this country. It's fundamental to a democracy. But that right to education is meaningless if our children can't have safe schools. Thank you so much.